Next speaker is Dr. Kenshuk Marwah. He is a vitreoretina surgeon based at Gurgaon. So he is speaking on NGO and private setup role in curable blindness. So he is imparting community services, especially to the diabetic patients and other retinal diseases in the private sector.
Very good afternoon to the eminent dais, and it was a pleasure seeing everybody's guidelines and the work which is being done. So I'm going to talk about NGO and private setup role in the curable blindness. We had previously seen Dr. Rathi's work in the RIO and the amount of mammoth of work they are doing. But the balance is not there. The urban people also have, a lot of load of blindness, and they also are not aware. The education is lacking. So definitely the movements like the glaucoma awareness and these things really help to educate people, because people in the urban places are also getting blind. So why is that? That is because of the lack of education and communication between the doctor and the patient. So already we have discussed about the mammoth load of blindness. So 771 million people in the world can have a preventable blindness, which can be actually cured by glasses or by simple methods like trachoma care and other things which are still existing. It is not that they have been completely eradicated. So and the 77 people are curable blindness of cataract and other things like age-related macular degeneration, glaucoma. So and the statistics in India, there are estimated 4.95 million blind people. So the data will be increasing every year. It is not going to decrease. All the data that I have seen on the internet is all the previous data. So in the statistics, you see this the red bar, the pie, which is actually the cataract load. So the cataract load is definitely the highest number of blindness. These are the states. You can see the Haryana also in the orange sector. So the darker color is the load of blindness in the various states. So and Delhi NCR areas are also into that. And right from the college days, I think camps are being initiated. So this is my photo from the college days, when this was my first camp which I did in my college days. So I just have kept this photo with me, and still it is, I share it with everyone. So when I started my practice, we made sure that the RWAs and the neighboring societies, we used to do every Sunday, we used to do a camp. And we used to make people aware about glaucoma. So how can we private clinic people help in the prevention of blindness? So there are so many people who require financial support. So the kids around our neighborhood which cannot afford glasses, so we make it sure that we give them glasses and take care of that. So that is not a big costly affair. So that can be done and taken care. So these are the kids which are evaluated at our clinic. And we also partner with the general practitioners in and around the urban areas, and we hold on one Sunday in every month, and we conduct a diabetic retinopathy screening camp at a cataract screening camp. This was done in Chhodar. We also partner with the neighboring schools. Like I am a pass out of Don Bosco, so we keep one screening camp for the students who require checkup, and that is being done routinely. And the glaucoma awareness walk helps to make people aware of glaucoma in and around our city, and most of the people have collaborated with IMA in Gurgaon also to conduct free eye pressure checkup for the doctors as well as the other people around the neighboring areas. And various religious activities, like sir also said, with the Gurdwara communities and the temple communities, we can collaborate and keep camps regularly. So this was, and also we have big shopping areas in the urban population areas. So this is one of the areas in Nehru Place. So there also we conducted big camps along with the shopper community. So they helped us to give an area, and we conducted the eye checkups there. So, and with various hospitals also we collaborate to provide free eye checkup as an individual doctor. And like various NGOs like Satya Sai and Radha Swami Satsang and even Delhi Police, and we have conducted camps in the police stations and in the and wherever they have the booths. So we keep an area there, and we have conducted with one of the NGOs in Delhi, and we have conducted eye screening there also. So these are the Radha Swami Agra Medical Camp, which is done in Delhi and NCR in Faridabad, Gurgaon and Noida. And we also organize with the local Christian charity missions also, and we conduct eye screening there. And a very good team is also very essential. Like ma'am is also saying, like she is here and still the IMs are being conducted. And like sir also mentioned about the vision center. So we also have our optometry team which will be conducted screening this Sunday also. So when I'm in the conference, we are screening people in Gurgaon and other areas. And this was a program which was done by the NPCB. So in the Delhi Southeast district, we conducted a screening of 6,000 children, and glasses were given to the kids. So this was also within the NPCB this thing, and the spectacles were distributed to the children, and I saw the disparity and the myopia progression which is happening in the society. So that is also one cause of concern, which is the future concern, that the myopia is also progressing in our population along with cataract. So private eye screenings being done in Gurgaon in Haryana. And these are the eye screening done with the local PHC in Tughlakabad area with the tie-up of NPCB. And we also have a program of actually, taking refurbished frames and putting new lenses and giving to the patients. So we get a donation of old frames and we put in new spectacles and give it to the patients. And so we don't let any patient go, because if a patient is coming and you are diagnosing, like sir also told that if you have diagnosed, then better treat them also. So we get the funds from local charities, and we do cataract surgeries at our clinic also. And I think most of the doctors here are doing this. And even kids with ROP, people who could not afford, we have done laser for a few of the kids and diagnosed them. And we didn't charge anything from the parents, so we are trying to prevent blindness at that prematurity level also. So we know the role of the NGOs. NGOs are also doing a big role. So there are various NGOs which we are aware, like Shankar Netralaya with the Jaslo Community Ophthalmology Care. They also provide ophthalmology care to families with less than 12,000 per month. Institutions like LVPI, which are doing a mammoth of work in the South region, along with the Arvind Eye Hospital. Their model is a model which has been discussed and replicated all over the world. And Shankara Eye Hospital, I've been an alumni of Shankara Eye Hospital, Coimbatore, and they also have a very nice model where the 20% are private surgeries and 80% are the surgeries for the poor. And various supporting NGOs all over India, Rotary Eye Hospital, Lions Eye Hospital, you see almost everywhere. And the Seva Foundation, they are also working globally and conducting eye camps, and they also distribute spectacles, and nowadays they are doing diabetic retinopathy screening also. And there's another trust in Gurgaon, Lala Ram Chandar Memorial Trust. They are also doing a lot of work in the Haryana area under Professor Dr. I.M. Rastogi, which they distribute spectacle and medicines, and they conducted a lot of CSR projects. And we've been associated with the Bajaj Eye Care. They are also doing a lot of eye care surgeries with Rotary and several camps has been done in Panipat. And future trends is that the AI is evolving, and we can actually screen diabetic retinopathy through AI. And there are various tools which are coming where we can just take them to the camp, and any optician or any technician can take them and they can screen the diabetic retinopathy in the field also. So those things will be the potential breakthrough. And we have used the same technology with the VOC. We have done the camp in one area in Govindpuri, and I screened the patients in my clinic in Delhi. So this was done through the telemedicine. And similarly, there is something called the 4-eye vision. This is a work by Dr. Croy. So she has lenses, which are ready-made lenses. So whenever we see patients, and we can give them glasses there itself. We don't have to ask the patient to come again, because the patients cannot come, like ma'am is saying, they're traveling 50 or 100 kilometers. So if you are screening them, as well as give them glasses there and then only. So practical perspectives after the discussion is basically we need to have a sustainable community focused strategies. So government hospitals are doing their work. How can private practitioners give their role in this prevention of blindness, which sir has also supported. And obviously education, awareness and early intervention is very important. So we have discussed the key points. So it needs a collaborative effort for sustained progress by everyone's help. Thank you so much. And
Hello. It's indeed great presentation, and it's like you are doing
yeah.
this according to like PPP model, public-private partnership.
Yes,
It is
yes.
being supported by the government.
Yeah.
Being like encouraged
Yeah.
everywhere.
Yes.
So, in your experience, you have collaborated with the government?
See, like there was the government of India, like the NPCB, they hold out tenders for any evaluation and this thing. So you have to apply for that through the NPCB office.
No, no.
Yeah.
Have you collaborated with the NPCB for certain diseases?
yes, yes, for-
ROP and everything?
No, for the ROP, it was a private this thing on my own. So like since I've been in practice since 10, 11 years, there are many of my colleagues, my school friends, they want to help somebody who's in need. So I tell them, I share with them this, there's a case like this, would you like to help in this laser or something? So obviously, they would send the message in their friend group and something will come, and we do it in the minimum, whatever is available, so that the kid doesn't go or we waste time in the, because ROP also progresses very quickly. So if we have anyone who requires any help, we will try and help those people.
Thank you.
So that is one thing which I have done in my practice, is never send anybody back for the lack of money. So whatever is possible, we tend to treat that patient and then only send, because doctor is communicating with the patient and the family, so that bond can never come with anywhere else. That story will restart, he'll tell the history and everything. So why not treat the patient there and then only?
Thank you.
Yeah. Thank you.